Well, good morning, Dr. Rosensweet.
Good morning, Carolyn.
As always, it's nice to see you. As always, it's nice to talk with the women before we even come up. Welcome to everybody. And have a lot of questions here, so let's go ahead and get started. Number one, are you ready for me?
Yes, I am.
Okay. So, Dr. Rosensweet, I'm in surgical menopause. I do not have a uterus. I don't have ovaries. And I'm trying very, very hard to add in progesterone in with my estrogen. Do you feel that the micronized oral progesterone is better, or is the cream form of progesterone better? I've heard of 10 milligrams per day all the way up to 100 milligrams per day. And to me, that's a huge difference. If I do use the oral form, does Dr. R like the slow release? I do have a concern, very much so, about oral progesterone and my liver. Thank you. A few questions in there.
There's a core fundamental challenge that I hear, and I do acknowledge it's a challenge. It sounds like a woman is trying to manage her own case, and I understand why that happens, because that's necessarily that easy to reach out and connect with expert support in this area.
Yeah, so
And that's why I keep on returning to the job of a woman is to do what it takes. And sometimes it takes a lot, and sometimes it takes years. But the primary job is to seek out and link up with someone who really knows what they're doing. And it's like anything else. I've mentioned this several times on this, that I had a 1970 something Corvair van, and I decided I wanted to rebuild the engine. I had never done that, and I did rebuild that engine. And by golly, it actually made it 7,000 miles, at which point it ground to a halt and froze. And it became a permanent fixture at a child daycare center playground.
We don't know that story yet.
And then I had a Volkswagen van, and it needed an engine rebuild. And this time I didn't try and do it myself. I took it to a Volkswagen engine rebuilder mechanic. And because I was so interested in cars, I asked him if I could hang out and watch him do it. And he said, sure. And oh my God, there was hundreds of things that he did that I hadn't done. With a level of precision and knowledge and experience, I got it. I said, this is why my Corvair van froze. I didn't do this, I didn't do this. And, that's minor compared to coming up with the proper way to treat menopause when you're a case of one and you've never treated 100 patients yourself. I'm not saying it's not doable. I actually wrote the book, Happy, Healthy Hormones, believing that if women knew a certain amount about it, if they were fortunate enough to get good hormones prescribed, they might be able to oscillate their way in there. And I can't tell you, every day we're dealing with a new woman who she's got this story. Tried this, tried that, didn't know this, didn't know that. And, frustrating. Whereas if you do all that due diligence and commitment to find a provider who knew what they were doing, I know sometimes it's easier said than done. But check in with us in the menopause method. There's many states where we can assist you, and the organic oils are hopefully soon going to be available for a very, very reasonable price.
It's very exciting. Yeah.
All women. And now I'm going to go answer the question.
Oh.
I hear from the question, here's your main job. You have to get the right amount of estrogen. You had a total hysterectomy. Well, it doesn't even matter whether you had a total hysterectomy or you went into menopause naturally. They're both going to have the same challenge. You have to get your estrogen levels right. And let me repeat that. You have to get your estrogen levels right. You have to do that. You're super low in estrogen, and you need estrogen as much as you need anything. And then getting progesterone right. that's a challenge of its own. Sometimes it goes really easily. Some women take the topical progesterone, such as in the organic oils base. They find their right dose. I describe this process in the book, Happy Healthy Hormones. So download it. It'll give you a really idea, because I can tell that this woman has not read that book because she doesn't understand the process of dose determination. And we go into that process of dose determination. And you start low and you gradually increase, and you're after alleviating symptoms of insufficiency, which Carolyn has flashed up on Ins and Outs of Menopause, the symptom list. You're there to gradually increase to alleviate symptoms of insufficiency while stopping at or backing down from symptoms of excess if they develop as you're gradually increasing your dose.
Right.
And these are independent variables. We don't know how much estrogen to give you. We don't know how much progesterone to give you, but it's not hard. It's pretty simple process. You start low and you gradually increase, and we describe that in great detail in the book.
And you can read it over and over and over again.
And then also,
Really
you
learn.
also need testosterone and DHEA sooner or later. Most women need it sooner. So you got to do the same thing with that. There's 3 variables, and each woman, just like each man, is so individual. So much difference. Like, just to give you an example, I'm going to throw numbers at you, but they're not going to make sense. But what's going to make sense is the wide range. Women in our practice, they wind up needing 1.8 milligrams of estradiol equivalent of biased. That's the average. But the range is 0.8 to 2.6. That is a wide range.
Mm-hmm.
Well, it's not a problem. If you do the process that we describe in the book of dose determination, you'll get there. And some women are even outside of those marks. And then you want to.
Ooh, I lost you. Uh-oh.
Confirm that you're in the right zone by 20. Let's talk about progesterone. A lot of women do really well on topical progesterone. And some women just can't get enough through topical. And it's especially those women who have sleep issues. Now, there's an estrogen deficiency component of sleep issues. And man, you got to get that right. And if you're waking up in the middle of the night with hot flashes or racing mind, you got an estrogen component to your sleep disturbance. But there's a progesterone component to sleep disturbance. And sometimes taking progesterone orally, because of a special progesterone metabolite, really assists with this process. Now, I hear fear of this and fear of that, fear of the liver, fear of taking something orally. I have never seen a woman get into trouble with oral progesterone. And yes, 80% of it, 90% of it that you swallow in your mouth goes directly to the liver and is processed by the liver and doesn't even make it to your body. Only 10 to 20% does. But then why is the assumption there that that's going to be harmful? You're eating olive oil or oils, you're eating fats, they're going to the liver. Livers are an issue. And it's primarily because of the toxic things that our bodies are exposed to. The liver is the great detoxifier. So if you've got a lot of toxic exposure and you're drinking alcohol and doing other things that are really, they've got to be metabolized by the liver. Well, alcohol is very intense. You're drinking too much alcohol, you're going to hurt that liver.
Right.
Bad news. And so liver can be an issue, but I wouldn't worry about progesterone. I'd worry about alcohol.
Yeah.
And some people are taking medications they can add up and be tough on the liver. It's not like we don't pay attention to the liver. But oral progesterone, I've never seen it be a problem. Now, I don't know every progesterone taker on the planet Earth and what their results look like. It's pretty hard to overdose on progesterone. Because like all hormones, they're so powerful that if you take too much, you're going to get lousy outcome. In fact, we capitalize on that. When a woman has sleep disturbance and her estrogen component has been taken care of, we'll give her oral progesterone. And here's how we do it. We give 30 capsules of 50 milligram progesterone micronized orally, prepared by a compounding pharmacist. 50 milligrams, 30 capsules. And we give 30 capsules of 25 milligram. We have a woman start, most women start on 50 milligrams. And in a couple of nights, if they don't show improvement in their sleep, we have them go up to 75 milligrams. And a couple of nights after that, they still haven't gotten enough improvement, we'll have them go up to 100, etc. I've had women go up to 225. The most common dose range that women settle in at is somewhere between 75 and 125 or 150. It always varies individual to individual. And how do they settle in? If you take too much progesterone at night, so many women will wake up the next morning feeling like they were overdosed with a sleeping pill. They'll feel groggy. They'll feel drunk. They'll feel lousy.
Yeah.
So many hormones, because they're so strong, it's very unusual for people to take too much because they can't stand it when they take too much. They feel awful.
Right.
And that symptom card that is published in the book, where you can see symptoms of excessive amounts of progesterone, that can be your guide. Now, having said that, there are some women have a special sensitivity to progesterone, and it's a problem. And although we always want to give women progesterone, there's some women who just don't tolerate it. Well, how many things are not going perfectly for us in our health program? And how important it is to get everything 100% perfect. No, we do the best we can. And so I've never seen a woman not tolerate estrogen in the right doses. I've never seen a woman tolerate testosterone in the right doses when she needs it. And the same goes for thyroid. There's rare instances, and I have seen it, where women do not tolerate progesterone in any dose. Now, some of these women will start out with phenomenally low doses of progesterone and gradually increase, and we'll find the place where they can tolerate a little bit, and we'll go with that. But hey, in fact, here's someone who knows about progesterone. Just popped in. Hiya, Kim.
Good morning, everyone.
So so you do the best you can, because if you look at anyone in midlife and their health program and what their past looks like and how many things that they're bringing in to support their health, what their present looks like, you're not going to see perfection. And if it turns out a woman's body is not accepting progesterone, we accept that. There's jillion other moving parts, such as what you're eating and what you're digesting, and how skillful you are at dealing with the emotions and mind and stress of your life, and how much of the great work you've done to unveil and heal the emotions that we came to earth with. The fear, the sadness, the anger, the shame, the guilt, the emptiness, the loneliness. How are you devoted to and committed to that great work? And what's your toxic exposure, and how's your exercise program? And then there's the mystery, because not everything is predictable. This is not about math, and it's not about better living through biochemistry. There's thousands and thousands and thousands of missing parts and places of imperfection in our living and our healing program. And the great news is we're extremely resilient. Healing is possible. We don't make a big deal. If a woman is given progesterone, and we do due diligence to try and figure out if we can find the right dose, and she doesn't do it, we accept that, because absence of one thing in an ocean of a million things is, we just go with what's so there. So
may I ask you this, please, because it ties into another question that just came in that I can really sort of expound on here, because this woman, it's number 4 on the question list, but it's like progesterone Thursday today. We have testosterone Tuesday and progesterone Thursday. Um, she's saying that she's done. She's tried every which way, shape, form to take progesterone, and she's saying, here are my choices at this point. It's to either put in an IUD, get my uterus,
Oh, yes. Thank you. Yes. Keep going, please.
yeah, have the uterus taken out, or just go off hormones altogether. But I know if I do that, then I'm going to suffer more. So I'm just all over the place, she says. And
yes, I that is my diagnosis too. You're all over the place. And in many life challenges, sometimes we start off confused, befuddled, verblunged, and all over the place. But I sense an intention in there to solve this, and I think I would like to say I hate your solutions personally.
Yeah, I don't think she's happy with them either.
IUD or hysterectomy. I'm sorry to be so severely intense about it, but this is not something necessary. And they're a godsend. And thank God there's gynecologists who know how to do them.
I'm so sorry.
The drastic worst case scenario, IUD with a progestin in it, or a hysterectomy. So you need professional help, and you need to connect with someone who's really skilled and knowledgeable and has experience in treating women with compounded bioidentical hormones. And it's all right to float around in the initial confusion and panic stage, because we all start there with many challenges in our lives. And don't stop. Your job is this: find someone who knows what they're doing. Because I'm going to assert this about you, questioner, that a much kinder, softer, easier solution is available for you. Your body had hormones. Your body had estrogen and progesterone and testosterone and DHEA.
Yes.
There's terrific hormones available.
Yes.
And so just your job is find someone who knows what they're doing, and don't necessarily start out with throwing in the towel, which it sounds like you're panicking and doing. Find someone who knows what they're doing. They'll hold your hand. They'll walk you through all kinds of solutions. And sometimes it's challenging, and I understand this. And sometimes it's just so frustrating finding that provider, or even when you get with a good provider, some women have to go through these rather challenging processes to get the balance and the individualization correct. But I encourage you to do it, because time after time after time, when our providers put in the time and energy and care and turn on the microscope and zero in on you and your situation, and you work together really well and you team it up, you'll figure it out, because healing is possible. And the world of menopause is one of the easier places to do it. And
one would think
there are some women it would take us 3 to 5 months to even really start getting into where the woman is going, oh, wow, glory, hallelujah, I thought I'd never feel better, and now I do. Wow, I'm starting to feel better. Sometimes it takes a year. Sometimes it takes 2 years. And we're just patient. That's why you're called patients. And that's why I'm called a patient, because as a physician, I need to be patient
with your patients.
Not so irascible and irritable at times.
Aw. Thank you very, very
because
much.
It's worth it. Because what you're talking about is once you land it, and I'm going to propose, there's many, many women who have started out going, this is daunting. This is so frustrating. It's so hard. And I just can't get it right. There's many women who do get it right sooner or later. And then you've got 10, 20, 30 years and now your muscles are going to be protected, your vagina, your bones, your arteries, your brain, your skin, your libido, your energy, your metabolism. So it's worth the process.
It is worth the process. I've got to agree with you wholeheartedly. I have been there. And yes, I wanted rapid relief like yesterday, and
Yeah,
that
right.
it wasn't going to happen, but I didn't know, I really didn't. And
It's a real interesting life principle you're just mentioning there. There's so many things I wanted to solve yesterday.
yeah,
Or maybe I'd like to have solved it 10 years ago. Or how about 50 years ago? Or how about 70 years ago? Or how about in a prior lifetime? I wish I had solved it.
we wouldn't have had to go through all this.
That's right. This life on earth has got some challenges to it.
It's true.
And the panicking, I understand where it comes from. I understand sometimes the deep well of panic and fear that's in there. And you're using this as an outlet to contact and do something really skillful with that deep well of panic and impossibility and hopelessness. Because as human beings, we come to earth with unfinished emotions stuffed in there like a knish, and they're going to want to come out. And they're going to find a pathway to do it. And menopause is the perfect pathway because it's midlife and there's a real reevaluation going on of your heart and soul in midlife. I know I'm being a little obscure here, but here's where I always like to start. Respect with what's going on. Well, what's going on with this particular questionnaire is panic. Sounds like, I mean, I know that might be a harsh way to put it, but that's what it seems like, plain and simple. So panic's emerging. Okay, let's accept that. Let's trust that. Her job is to go out and get skills to help her deal with panic. These are emotional skills. These are mental skills, and that body of knowledge is out there. And really, what's inside panic is fear. So your job is the medicine you need is to acquire information, tools, and support to be excellent at fear and hopelessness because you got them raging in there. And so the very thing that's happening to you could be the clue to the thing that's going to improve your life enormously.
Right.
So that's why I like to respect exactly what's going on. And no amount of progesterone or a hormonal balance is going to address what can pop up at midlife, the fear, the sadness, anger, shame, and guilt, because it's standing in the way of love. It's standing in the way of happiness. If you don't process that, that's what the great work's about. So let's just take that questionnaire at face value and say, oh, confusion, panic, desperation, if that's what's showing up. So the medicine is, in the process of getting hormonal balance, which may never work because the body's not going to do better living through biochemistry. And I can tell you that.
Right.
The body is gonna stop your world for you, to break you down, to get you to ask the question, what in the heck is going on here?
Yes.
And what in the heck is going on here? You're at midlife, and it could be that emotions and mental thoughts that you've never really been successful with, and you've been repressing them your whole life in this lifetime. And you haven't gone out to get the help, the support, the knowledge, the skills to be able to guide yourself into your emotional challenges skillfully. Oh, it's such a gift. It is so important. It's life-changing. It's the doorway to liberty, to freedom, to joy, to non-attachment, to love, to intimacy.
It's
But
the
those
word
feelings
we're
are standing in the way of that. So I know I'm racing through stuff, and this isn't really about the ins and outs of menopause, but it's about the deep river of menopause.
Well,
The midlife crisis. Gee, where'd that term come from?
exactly.
It came
Exactly.
from, there's a natural process midlife to throw people into a reevaluation. Like, okay, I've been cruising along here for 50 years. How am I doing? Am I meeting the dreams of my and visions of my heart and my soul. Uh-oh, falling a little shy here. All right, well, what do I really need to do? What do I need to do with my own emotions, my own mind, my own choice mechanism, my own creation mechanism to really bring it on in for the next phase of life and develop what really matters? And what's it going to come down to? Love and fun and happiness and family and community. Because we're human beings, and that's the kind of stuff we like.
Right. And so walking around panicked and angry and
That's
frightened.
good because it's come out, it's exploded out into the open.
Right.
Now it's showing you what's happening. That's the truth of what's happening. So we respect that and we give that what it needs. You're having an outblast of uncomfortableness. And so you got to get skills to deal with uncomfortableness. And in this day and age, you can go online and you can do some significant searching and find the teachers and the mentors and the guides that know how to help you with your emotions, with your mind,
Yes.
with your life.
Yes.
And really, it's all about you get more skills so that you can create what you've always dreamed of: the fun, the happiness, the joy, the pleasure, the intimacy, the love that you've always dreamed of.
And then
well, there's an answer about progesterone, if there ever was one.
the missing
Even
link.
though progesterone is one of the most calming and equilibrium, mental, emotional equilibrium creating biochemicals on the planet Earth, it won't work. Nature is much more powerful and much more clever than that. It's not going to let you take Valium and knock yourself on your butt, and because anxiety's coming up, and that's going to be the resolution to anxiety is Valium, Xanax. That's not the ultimate. That anxiety is there for a reason, and it's come up to be healed. So better living through biochemistry. Why don't you get really sophisticated? Instead of taking Xanax, why don't you try and jack up your progesterone? No, nature doesn't allow that stuff. There's no workarounds.
It abhors a vacuum.
You gotta identify what's really going on and address it, and then you can get into hormonal balance. Then your body's gonna just receive it like manna from heaven.
Operative words: receive it, receive it, receive it. Yeah. Wow. Thank you. I mean, it almost makes we just need to be quiet for a minute. I mean, it's a lot to take in. Midlife crisis. Midlife crisis.
It's a natural phenomenon. It's a reevaluation. It's it's rising up with such intensity, always with the same motivation, to get you to stop in your tracks and ask, what the heck is going on here? Really?
Right.
But the issue is your being wants the real answer. It doesn't want, this is a Xanax deficiency. That's not the real answer.
No.
It wants the real answer.
Right. It's not a
And
value.
it's going to be something that matters to you. Oh my God, I've got relationship issues and I don't have the skill.
No, don't freeze. There you are.
So it's going to want the real answer. Oh my God, I've got to learn how to open my heart. My heart's been closed. I've been self-circulating. Oh my God, my heart. I'm telling myself the truth. My heart doesn't know how to open. That's a midlife crisis. Those are the kind of things that happen midlife.
Yes, for a man or woman.
They're very basic.
Yes.
I don't know how to find my own internal peace and happiness and joy. I'm troubled inside by emotions and thoughts that they're just raging in there, and I don't know what to do with them because you don't have the skills and the support, the information, tools, and support, because that exists, and you can go out and get it. So you have to do stage one. You have to identify what's going on, really. Oh God, I'm emotionally troubled, and it really interferes with my relationships and my fun and my job and everything. Okay, what's the medicine? Go out and find information, tools, and support to help you with your emotions and your mind. And it's available to everyone. I mean, AA has got some wonderful things in it. And there's counselors and therapists that just really know how to help you get down to you, because you is good. And if you get down to you through that, and then there's God on the internet. There are such amazing teachers and there's such amazing information that you could learn how to work with your own emotions and guide yourself. Just if you found a teacher that makes sense to you, that you feel comfortable with, and you go
Yeah.
listen to and read all their stuff. A woman who's having in trouble in relationship and trouble with communication should check out Marshall Rosenberg and his nonviolent communication or compassionate communication. Because sometimes if the intent is there, the ability to communicate can get you there. There's thousands of these kind of things. Okay, that's about progesterone. That's what I have to say about the Marina IUD and hysterectomy. That's
Yes.
where that took me.
Yeah. 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 I'll leave that alone. But this woman, she's amazing, and she's gonna make her way, and I know it. And thank you very much for that answer. When you go there, I really enjoy it because they are nice words of wisdom, and from you, they sound wonderful, and I appreciate it. I know we all do, and I
There's
know
a
you.
practical issue there too, Carolyn.
There's what?
There's a practical issue. Is a human being, a man or a woman, going to take a stand and go, I want to improve my life, and I'm going to reach out for information, tools, and support that makes sense to me. I'm going to do the great work, which is working on my emotions and my mind and how I choose and the choices I make. I'm going to work on the issues that I have around self-hate and self-love, or around not being able to open up in relationships, or having trouble at work. I'm going to penetrate that by giving it the time and attention and courage and commitment to my own healing process, my own emotional healing, my own healing of my own mind. So there, the practical, excuse me, the practical issue is, are you going to do it? Are you going to say, I'm going to go out there and seek the information, tools, and support to improve my life and to have the life that I know is possible? It's the life of my dreams. I know I can get there. I'm gonna go out and do that. And if you have that intention and you're willing to do the work and you've got some courage, it takes courage to face your own fear.
It does for sure.
It's
Yeah.
much easier to hate somebody.
Yes.
I'm just
Well,
going to hate the opposite party, political party, because in hating them, I get to have some kind of outlet for the uncomfortable feelings I have. It's insane what's taking place in the United States of America. It ain't your neighbor, folks, and it ain't the opposite party. Ta-da! Look at Carolyn, what she's doing there.
I'm
And
telling you,
so,
I had to do the work. I do the work every day. I thought I was done with the work. I do, and it's not quite so.
and
It can
then what does that give you access to? You do the great work, and you start healing your own uncomfortableness, your own anxiety, your own depression, which is really what's inside of that is your own uncomfortable feelings of fear, sadness, anger, shame, and guilt, etc., and your own unbeneficial thoughts and choice patterns. You go in and do that. That can put you at the starting line for being exposed to who you really are and the life
right.
that's really yours to live.
Yes.
And what's in that? Happiness, friendship, community, love, fun. This is what our nervous systems need. A lot of that.
That vagus nerve.
a lot of. So anyway, I'm going to stop.
Okay, well, thank you. Thank you, Dr. Rosensweet, the doctor of many doctornesses there for sure.
Many doctornesses.
Yeah, many doctornesses. It was my father's life's work, and he was a cool guy. So thank you. Returning to the land of menopause, there are a couple of questions that have come in regards to uh, one is, can you retain water from going off of hormones? And it's a weird question, but I kind of get it. Um, the question is saying, I think I do. Other women are also saying that they do as well. I've only been taking estradiol, but I feel puffier when it drops. And I don't understand why that is. I thought that estradiol was supposed to make you retain fluid.
These hormones are related to fluid. And not only that, no matter what you learn about anything in the body and how it's supposed to do, most of the time it does what it's supposed to do.
Mm-hmm.
But I can't tell you how many thousands of instances in dealing with real patients that instead of doing what it's supposed to do, we get something called a paradoxical effect.
Right. Yeah.
That means you're getting something that's the opposite of what it's supposed to do. Now, I'm not saying that's what's going on, because in the world of hormone balance, I see so much amateurness when I go on to the Facebook page of the ins and outs of menopause. It really is a concern to me. People giving each other advice. I really, when they haven't got the information and tools and experience, it's very disturbing to me. And if you know a little bit, it doesn't. But at any rate, I won't go there. And we're going to start answering questions directly off that Facebook page. So I also want to weigh in and not have to, so that you don't have to just have some of the disturbing and incorrect answers that are being thrown at you. I want to weigh in there with my opinion as well.
Uh-oh.
The whole thing about hormones is, if someone knows what they're doing, this is what they do. A professional that's had training in this and experience in this. And the training's quite extensive. I mean, when we train a new person and they meet up with the body of knowledge that is about menopause and hormones, practitioners, and they meet up with our professional training and they go, oh my God, I didn't know that. I didn't know this field was so big.
Right.
And when you meet up with someone who has that training, they're going to go through a process that's time immemorial honored. They're going to come up with a series of agreements with you to see if it's appropriate to be a team and working with you. For example, in the menopause method, we always insist upon a woman be willing to do mammograms and blood tests, mammograms and blood tests, and bone densities and other stuff that we think is critical for giving you the best medicine. We give you a 12-page questionnaire. Oh, that's a piece of work. But in that 12-page questionnaire that you fill out online and that provider sits down with you, oh my God, dude, they learn a lot about you. And when you really learn about someone and the details, the cool thing is the next steps come to the provider.
Right.
See enough to know at least what to do tomorrow. And then we'll see what the result of that is. So when you go through a proper process, the next steps to try are right there. Sometimes those are very well understood, common pathways of, this is how you start your estrogen. This is how you find your right dose of biased. This is how you find your right dose of progesterone. This is the starting dose. This is the starting dose of testosterone and DHEA. And by the way, we're going to take a real close look at your thyroid too, which is often catawonk by the time of midlife. And it's a very natural, normal process. But sometimes it's not. And I don't know if this particular questionnaire is having a paradoxical effect, because she's correct. I usually associate, well, let's talk about estrogen. A woman dries up when she loses her estrogen.
Mm-hmm.
Skin, the skin of a woman who hasn't had estrogen for a couple of years is not the skin that she had when she was 25
No.
or 14.
No.
Huge difference. There's a difference in the actual microscopic anatomy and microbiology of what's going on. Older people's skin who are not on hormones, that skin dries up and it looks wrinkled and old. And one of the main things about it is insufficient estrogen. Dehydrated and dried up, loss of fluid, and you replenish the estrogen, and your skin comes back alive. It gets full and healthy looking, and the kind of skin you want. That's the usual thing, hydration. However, if you take too much estrogen, and this is, I think this woman knows this, you can get too much fluid retention. And you can get swelling of the lower extremities. That's the common thing. But as I listen to this questionnaire, it sounds like she's not having that common response. She's having a paradoxical response. Okay, well, every healthcare provider who's been around the block is very familiar with people who don't have the predicted common response. So you deal with that. You figure them out. It's just part of a natural process for someone who's got some experience and some knowledge. And then as far as hormonal and fluid balance goes, progesterone's a big one. Progesterone's a diuretic. Holy mackerel, diuretic. That means if you got the right amount of progesterone, you're going to be peeing out the proper amount of pee every day. You won't be retaining it. Some people swell because they don't have adequate progesterone. And you give them adequate progesterone and they're peeing it out and their swelling's going away.
And they're happy. Yep.
So, but to try and sort this out when I have a couple sentences of information, that's not how we do it.
Yeah.
We ask, it takes a woman an hour to fill out our questionnaire, minimum. It takes us an hour to review it with that woman in that first consultation. Why do we do such an extensive questions like that? Because we can learn about the individual woman and we can see patterns, and more important, it'll lead us to, okay, well, what's the first step to take? So that's what's missing, a proper process. So the job becomes the same job over and over again. The job is go hunting, go shopping. In the old days, when Carolyn and I were walking around the tundra, we had to take a big sharp stick and go hunting for javelin and use the stick as a javelin for saber-toothed tigers. I remember it very clearly.
And I do too.
It was hard to take down a saber-toothed tiger that was attacking, but it was doable back then. Well, today's hunting job is very different. Today's hunting job is you got to go out and find a healthcare provider that has been loves to cooperate and synergize. That's today's hunting job. It ain't the saber-toothed tiger with a sharpened stick like it was back in the day. It's go find a healthcare provider. And now with telemedicine, there's someone in your state that has been caring about this and treating women in menopause with compounded bioidentical hormones. And if you want to know the kind of things that you need to look for in that provider, read our book, Happy Healthy Hormones. You're going to be able to go out shopping. And one of the questions you can ask them right out of the gate, are they doing 24-hour urine hormone testing? It doesn't mean they're not going to be good if they're not. But those who have taken on 24-hour urine hormone tests, they're at a different echelon. They have figured out that, oh yeah, look at this. This is very important. It's just a simple way. But you may not find one of those folks, but you can still get some good work out there. But that's your job. Go hunting.
If we did it back in the tundra days, it's still doable today, because I guess that primed me to do the hunting I had to do to find my doctors. It is doable. My line that you always kind of tease me about is like, hang in there. It's my prescription. Hang in there. It's doable, really. And if we can help you to get there, just please, please reach out to us. Um, So if a woman is postmenopausal and using a 0.25 estrogen patch, should she take progesterone each night rather than in a cyclical method? Do you
Oh,
feel?
yeah.
I'm sorry?
Oh, yeah. Right.
Yeah. So do you feel that that taking progesterone every night would diminish some of the benefits of estrogen?
I'm going to approach it from a different direction.
Okay.
The job is always the same. A woman's ovaries put out 4 hormones, a couple estrogens that are really critical, progesterone, testosterone, and DHEA, and they're all critical. And every woman is different. So some women, their emphasis is on the estrogens. They're estrogen rich. Other women are testosterone rich. Other women are progesterone rich, but they all have all 4 hormones. And that output peaks at the age of 20, plus or minus 2 years or so. And it gradually declines. And the job is always the same. Replenish all 4 of them. Don't leave any of those out. They are critical. I see people leaving out testosterone, for example, all the time. Wrong. You're going to need testosterone as much. It's not a male hormone. It's a human hormone. And you're going to need testosterone as much as you're going to need anything. Well, how does a woman lose her bladder control and wind up with adult diapers? One of the reasons is loss of testosterone. How does a woman lose her muscles and has to go from a cane to a walker to a wheelchair? Whoops, that's a big transition there. Walker to wheelchair is often the roadmap to going into assisted living or a nursing home, right there. So you need all these hormones, and you need the right amount for your body. One of my favorite things to do, which is extremely rare, is to do a 24-hour urine hormone test on a 25-year-old.
Oh.
And then say, why don't you keep this? Because when you go into menopause, you'll be able to hand this to someone who knows what they're doing. And you're going to see the particular individual balance that you had between estrogen, progesterone, testosterone, and DHEA, not to mention thyroid.
Right.
And so what's the good news of what this questioner is saying is she's found her way to a patch. That is definitely not my favorite way to approach this. I like compounded bioidentical hormones. The patch has estradiol alone in it. Estriol is a very important ovarian estrogen. You can read about why it's important in the book. But listen, if the only thing I had was patch to treat women with, I'd celebrate it. It's at least got estradiol in it. The actual correct way that patches come is it would be a 0.025 or 25 microgram patch. But that's neither here nor there. That's a pretty low patch. More women are coming in with the 0.50 patch. So I question whether you're getting enough estrogen. And here, what are we doing? We're talking only about estrogen. That's not enough. Uterus or no uterus, you need progesterone as well. So you've got to go through a similar process in sorting out, how am I going to get my progesterone? How am I going to take it? And what's my optimal dose? And you can work with symptoms, and we describe that very carefully in the book. Like a symptom of not enough progesterone can be my mood's little, I'm upset, I'm anxious, I'm not calm anymore. I used to be calm, now I'm upset all the time.
Yeah.
I got anxiety, restored, and they're not falling asleep. These are some symptoms common enough with progesterone insufficiency. So you take progesterone on as project number 2. We do it in the menopause method. We take them both on at once, the estrogen plus the progesterone. And there is no magic mathematical formula. Just because I know how much estradiol you have, I have no idea how much progesterone you need. Women vary enormously as to their own internal balance of those four hormones. Some
Right.
women have a relatively rich amount of progesterone as compared to the amount of estrogen they have. Other women have a relatively rich amount of estrogen compared to the amount of progesterone they have. Well, no big deal. You just figure them out as independent variables. And you start low and you on any of these hormones, and you keep building up until you alleviate symptoms of insufficiency. And if you hit symptoms of excess, you back down. That's how you find your dose. It's called titration.
Right. And
You also got to do this with testosterone and DHEA, and you got to get this balance right. So you're walking into the territory. You're up at 0.025 patch is a decent start, but you're not done with estrogen. I'd be shocked if you were done with estrogen.
right. Well,
I would head you in the direction of biased rather than estradiol. But if estradiol patch is all you have access to, that's a good tool. And then you got to do a similar process with progesterone. I'm always a strong advocate of compounded bioidentical hormones, and in the organic oil space, that's the safest, most elegant way to take it. So again, you're on your way. You're working your way into menopause. You got a good start, and then you need to be with someone who knows. Well, we got to find out what that right estrogen dose is and what the right estrogen combination is, because 0.025 may not be enough. It's not going to be many women that's enough to protect your bones, to protect your vagina. Well, how do we know if it's enough? Well, there's a lot of women who have symptoms of estrogen deficiency. They have hot flashes, et cetera, et cetera, et cetera. And so if that's enough, those hot flashes are going to disappear. 75% of the women have symptoms, but 25% don't. So how do you know if that estrogen patch is enough? You get a vaginal exam. Or if you're having intercourse, if you have to use lubrication, you don't have enough estrogen. You're getting vaginal atrophy. And that patch over time should restore the health of your vagina. And if you've been on that patch for 6 months or 3 months and you're still having to use lubrication, you don't have enough. You need to increase that dose. Because the health of the vagina is just like the most amazing indicator of whether a woman has sufficient estrogen.
Yes.
Now, for those who are not having intercourse, sometimes you have to do it by exam. Have a professional examine, because a gynecologist or a family doc who's used to doing pelvic exams, nurse practitioner, they can look at your vagina and they can tell you in a flash whether or not you've got a healthy vagina or not.
Yeah, I think a lot of us women know. You can feel it. It's pretty brutal.
Yeah, so that's going to talk to you about the patch. And then there's a whole symptom list, and Carolyn's posted that symptom list. And of course, it's in the book in significant detail. And then you got to go for progesterone. How are you going to get the right progesterone? Well, there's symptoms of progesterone insufficiency. And you can start taking progesterone at lower dosages and keep increasing it until you get an overdose. If you take progesterone at night is when you should take it, and you wake up groggy in the morning, you took an overdose that night before, because progesterone is the great calmer. But too much calm means in the morning you're gassed, as my father used to say.
We used to say gacked.
Yeah.
Yeah, gassed. You know, the last question, we won't answer it because it's too long and it's too big, but we'll bring it up next time. I just want to acknowledge the questioner. And it's something that we have talked about many, 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 many times. You explained this to me so beautifully way back in the day. And it has to do with women getting heart palpitations, women getting anxiety, women feeling really weird, women going to the emergency room, thinking they're having heart attacks, being told that it's
I
all
would
in
like to drop a few words about this, because, like you're
there.
saying, this is an important question.
It's huge.
Because women do go to the emergency rooms thinking they're having a heart attack.
I know.
There's a lot of causes of palpitations. But in the perimenopause, the very first thing we think of is estrogen insufficiency. And that's very stressful to your body to have estrogen insufficiency. Just like a man, take away his testosterone. Ask him, does he feel stressed or not? Lost his erection. How's that going for you? Does that feel very stressful?
I'm sorry to laugh.
No, it is funny. It's very stressful, and it triggers the fight or flight. Just as like you were back in the tundra being attacked by a saber-toothed tiger. Biology is the same. It triggers adrenaline release and cortisol release. And that adrenaline makes that heart race and makes it pound in that chest. And it can even constrict just enough to make you think, oh my God, I got pain in my chest. I got chest pain. I better go to an emergency room. And I have a relative that's exactly what happened to her. In the middle of the night, she winds up in the emergency room, gets a cardiac catheterization. And her arteries were fine. She was just having symptoms of low estrogen, which triggered the fight or flight biology. And guess what? It's time. So we could pick that question up like you were thinking, Carolyn, for next time too, because it's
that's huge.
An important question. It's a very common thing. So I would like to address it.
Yeah. Again. Okay. Well, hard stop. Thank you, everybody, for coming up. Dear Dr. Rosensweet, have a wonderful weekend. It's always good to see you. Appreciate today's interview so much. And yeah, we're going to get lots of good questions for sure, as we always do. And I'll have them ready for Tuesday. So for everybody, enjoy, be happy, have lots of fun, and we'll see you on Tuesday.
See you on Tuesday, Carolyn. Have a good weekend. You and Daryl. Yeah. Bye-bye now.
Bye, y'all.